Falls are one of the most serious health risks facing older adults today, and they remain a major public health challenge. The National Council on Aging reports that 1 in 4 Americans aged 65 and older will experience a fall this year, contributing nearly 3 million fall-related emergency department visits annually, according to the CDC. The financial impact is just as staggering. By 2030, the cost of treating falls-related injuries in older adults is projected to exceed $101 billion.
There were places that I wouldn't bother to walk because I thought I'm going to be too tilty.
Falling is the #1 cause of them having to go in a nursing home or not recovering. So this is preventative.
It used to be if I was standing and I could shut my eyes, I would want to tip over.
Across New York State, YMCAs are stepping up to reduce preventable injuries and support healthy aging. Thanks to a 4-year federal grant awarded to the Foundation of New York State YMCAs by the Administration for Community Living, this initiative is building and expanding evidence-based falls prevention programs like enhanced fitness, moving for better balance, and a matter of balance for communities all across New York State. With this support, YMCAs are training new instructors, strengthening program capacity, and offering life-changing falls prevention programs not only inside our facility, but everywhere older adults gather. Senior centers, churches, libraries, and even repurposed retail spaces in local malls have become welcoming hubs for balance, strength, and confidence.
The instructors were incredibly focused on us. It was obvious that they wanted to help us succeed.
From day one, we start moving, and sometimes there's a fear factor. Once they start moving, the expression on their face is just priceless.
I want them to feel like, yes, I did something today, and yes, I was successful at it.
At the YMCA of Ithaca and Tompkins County and the Cortland County Family YMCA, this grant has been truly transformative for us. In Ithaca, it has allowed us to bring falls prevention programs directly into the community and expand our virtual program offerings, meeting older adults where they are and lowering financial barriers so more people can participate in falls prevention programs.
The signature move of moving for better balance is just a sway from side to side, shifting the weight from right to left. And I see people when they're waiting for a class to start, just kind of doing that little sway from side to side.
I felt excited because it looked like it was going to give me exactly what I wanted. And they explained that we were going to go through a very methodical practice and build up as we went along and keep adding more techniques every week.
We did one program at a local senior citizen residence, and people were coming in with walkers. So we saw that. And by the end of the 12 weeks, these walkers, sometimes they didn't bring them at all. And if they did bring them, they parked them in the corner.
Each day, there's a little more progress and a little more progress, and they're like, okay, we can do this. We can do this.
I do feel more stable, and I continue to practice the exercise I've learned to try to maintain that stability.
At the end of this 12 weeks, they look amazing.
It's fun and it feels good. And it's a pretty form. It looks good. And people see themselves in the mirror and they're like, wow, look at me.
In Cortland, it has enabled us to launch critical falls prevention programs for the very first time. These opportunities simply wouldn't have existed without the support of this grant. Thanks to funding, older adults in our region now have access to life-changing programs, and we're building a sustainable foundation to continue offering them for years to come.
They're getting stronger just in 2 weeks. Their coordination and balance has already gotten better. Their brains are going to function better because that is a muscle as well. And just it's also social for everyone. They're wanting to sit next to their friends, and they're smiling more because they're not afraid. They know they can do it. So I think it's just good for all of them.
And the impacts of evidence-based falls prevention programs are undeniable. New research from the National Council on Aging shows that the participants in evidence-based falls prevention programs experience a 52% reduction in the number of times they fall and a 26% reduction in hospitalizations.
It really paid off in terms of things that are going to stick with me. I can keep doing them. They're simple enough to do while you're, even the shifting foot to foot while you're doing dishes and stuff. And I continue to use the things that they gave us.
The falls prevention classes that we've taken to the community, I really think it's nothing but beneficial. We've had places ask for it to come, and I think that's amazing, that we can get it out to as many people as possible.
This program should be available anywhere there are people over 60.
But they are happy, they're smiling, and they say to me, I'm really proud of myself.
These aren't just numbers, their lives changed. Every class, every instructor trained, and every new community partnership helps older adults stay active, independent, and safe. At the YMCA, we're proud to lead this work statewide, and we're just getting started.